I have worked out recently that I have now seen over 10,000 patients with asthma in my career as a respiratory physician over the last 15 years. And after a while, you start to see something that no textbook really prepares you for. Patterns. Things that appear again and again. And the pattern I keep noticing isn't really about the asthma attacks themselves. It's about what came before those attacks. The patients I see with severe life-threatening asthma, the ones being admitted to hospital, the ones who have had a near fatal attack, the vast majority had warning signs. Signs that had been building for months, sometimes years, and nobody had spotted them. Or if they had, nobody had acted. Something shocking, 2/3 of asthma deaths in the UK are preventable. That's not my opinion. That's the finding of Royal College of Physicians' own national review. 4 people die from asthma every single day in this country. And the reason it keeps happening is that we are brilliant at treating asthma attacks, but we are poor at recognizing when one is coming. If this is your first time here, hello, my name is Dr. Suman Paul. I'm a respiratory physician in the UK and a principal investigator for clinical trials in lung diseases, including some of the most advanced biologic therapies available today. My role increasingly is to help people understand their lungs before something goes seriously wrong. What I want to do today is to give you 6 markers, 6 specific signals that I assess in every asthma patient I see. Because if you know these 6 things, you have everything you need to know whether your asthma is under control or whether it is quietly heading towards a crisis. Now, I'm not saying this to frighten you. Here is what you actually need to know. 95% of asthma patients who monitor the right signals and work with their respiratory team stay out of hospital entirely. That isn't just reassuring. That's the whole point. Think of it like this. Your asthma is like the engine in your car. If you check the oil, if you pay attention to the dashboard warning lights, if you deal with small problems before they become big ones, that engine runs safely for decades. But if you only ever look under the bonnet when something has gone already wrong, then it is not going to be helpful. That is exactly the situation I see in my clinic every single week. These 6 markers are your dashboard. Most of them you can check at home right now. Each one is telling you something specific about what is happening in your lungs. Here is what actually happens with most of my patients. It isn't that they haven't had symptoms. They have. They have felt a bit more breathless than usual. They have been waking at night. The blue inhaler has been getting a lot more of use, but they put it down to the weather or getting older, or just having a difficult week. And this is completely understandable. When symptoms arrive gradually over a month, your brain adjusts. They become your new normal. You have only ever lived in your own body. You have no other version of yourself to compare to. So you don't know whether the breathlessness climbing those stairs is just what 60 feels like, or whether your asthma has quietly been losing control for the past 6 months. But there is something even more important you need to understand. The only way to find out is to measure the right things. And these are the 6 I would measure if you were sitting in front of me in clinic right now. The first marker, and the one that surprises most of my patients when I explain what it actually tells you, is your peak flow rate. A peak flow meter costs about £10. You blow into it as hard and as fast as you can, and it gives you a number in liters per minute. That number is a direct measurement of how fast air can move out of your lungs. It is a blood pressure reading for your airways. Here is a game-changing part most people miss. It's not the absolute number that matters most. It's your number compared to your personal best. A reading below 80% of your personal best is a yellow zone warning. Below 60%, red zone. That is your engine light flashing. What I see in clinic again and again is peak flows drifting down over weeks, 85, then 78, then 70, and no one notices because there has been no consistent monitoring. By the time that patient arrives in urgent care, the reading is 50% and they are shocked. The decline had been happening for months. A peak flow meter, £10 from any pharmacy or even Amazon. Check it every morning before your inhaler. Write down the number. That simple act, measuring and recording, gives me as your respiratory physician a minimum 2-week window to intervene before the things become serious. Without that data, I am working blind. The second marker is the one I find most often overlooked. How often are you using your reliever inhaler? Most patients think of the blue inhaler, Salamol, Salbutamol, Ventolin, as a rescue medication, something you reach for when you feel bad. And that's correct. But it is also a measuring tool, and it is measuring something very important. If you are using your reliever inhaler on more than 2 days per week, not 2 puffs, 2 days, your asthma is, by clinical definition, poorly controlled. That is the threshold from the updated NICE guidelines in the UK. Something even more important you need to understand, one of the key risk factors identified in the Royal College of Physicians review of asthma death was overuse of reliever inhaler, combined with underuse of preventer inhaler. This combination is not simply a sign of poor control. It is a recognized risk factor for a fatal asthma attack. I'm not saying the blue inhaler is dangerous. It isn't. What I'm saying is that needing it frequently is your body raising its hand. It's the warning light on your dashboard. And if you are reaching for it daily, that is not normal asthma management. Count how many days in the past week you use your reliever. If the answer is more than 2, that is worth a phone call to your GP or respiratory team today. The third marker requires no equipment at all. Are you waking at night with breathlessness, coughing, or chest tightness? Nighttime symptoms are not, as many of my patients assume, simply part of having asthma. They are a specific clinical signal. Waking more than once a week with respiratory symptoms is the threshold for uncontrolled asthma. That's in the BTA, SIGN, and the updated NICE 2024 guidelines. Here is what is happening biologically. Overnight, your cortisol levels drop. Your airway tone changes and inflammatory processes become more active. The airways of someone with poorly controlled asthma narrow further during sleep than during the day. So if you are waking at night coughing or wheezing, you are not simply having a bad night. You are seeing the result of inflammation that has been building quietly all day and revealing itself when your body defenses are at their lowest. Ask yourself now, in the past month, how many nights have you woken because of your breathing? If the answer is more than 4, roughly once a week, that is a signal, not a reason to panic. The fourth marker is the one that is most often dismissed, and it is the one that bothers me most because the mistake is so completely understandable. Are there things you use to do comfortably, like walking upstairs, carrying shopping, keeping up with your grandchildren, that now leave you breathless in a way they didn't before? Here is what I hear most often in clinic. I assumed it was just my age, doctor, and that assumption cost years of lung function. Exercise-induced breathlessness in an asthma patient is not a normal part of aging. It is a marker of poor disease control. When the airways are inflamed and partially narrowed, physical exertion demands airflow that a compromised airway cannot deliver. The result feels like age. It is asthma. I have had patients in their 60s who had stopped walking the dog, stopped taking the stairs, quietly reorganized their entire life around breathlessness, and assumed this was simply what getting older meant. When we treated their asthma properly, they got that life back. Let me show you why that matters. Breathlessness on exertion is treatable, but only if it is recognized as asthma rather than normalized as aging. It is not what most people think. Number 5 is your resting breathing rate, and this one surprises people. Most people have never counted how many times they breathe per minute at rest, but that number tells you something important about the work your lungs are doing right now. A healthy resting breathing rate is around 12 to 16 per minute. Anything consistently above 20 is elevated. And in an asthma patient, a chronically elevated resting breathing rate is a sign that the airways are working harder than they should be, that there is airflow obstruction even at rest, even when you feel fine. You can check this right now. Sit still, count how many times your chest rises over 30 seconds. Double it. If that number is above 20, it is worth noting and worth discussing with your doctor. What it tells me clinically is that even when a patient says they feel okay, if their resting breathing rate is 22 or 24, their lungs are compensating. And like all compensation, it has a limit. The final marker on this list is the one that has most changed how I manage asthma in my clinic, and it is a simple blood test. Your blood eosinophil count. Eosinophils are white blood cells. In asthma, they are the primary driver of type 2 inflammation, the process that causes your airways to swell, narrow, and become hyperreactive. And the level of eosinophil in your blood is one of the strongest predictors of your risk and your treatment options. Here is the game-changing part. If your eosinophil count is above 300 cells per microliter or 0.3 in the NHS blood results, you may be eligible for biologic therapy, a class of medication that in my clinical experience can be genuinely life-changing. However, it only works or is eligible to be prescribed if you are having asthma, exacerbation, and steroid courses. I have patients who had been admitted to hospital repeatedly, who had been on high-dose steroid for years, who are now completely attack-free on biologics. That outcome depends entirely on knowing this number. But here is what I see again and again. Patients who have had asthma for decades, who have never had this blood test done. Their GP hasn't ordered it. No one has looked. This is a standard blood test. It can be done at your GP or arranged privately if you wish. If you are using your reliever more than you would like to, waking at night, or your peak flow keeps drifting, ask specifically, has my eosinophil count been raised? That one number could change everything about your treatment pathway. None of these 6 markers exist in isolation. They are pointing at different aspects of the same underlying process. Airway inflammation that left unchecked becomes an asthma attack. A peak flow trending down combined with more reliever use, combined with nighttime waking, that is not 3 separate problems. That is one picture. The picture of asthma losing control, and caught at that point where the signals are showing before the crisis, there is almost always something we can do. 4 people die from asthma every day in the UK. 2/3 of those deaths are preventable. Not because the treatment don't exist, they do. The biologics exist, the inhalers exist, and they work. The monitoring tools also exist. A peak flow meter costs £10. The gap is awareness. The gap is knowing what to look for before things become serious. Think of your asthma management like the annual service of your car. Watch the dashboard. Deal with the warning lights early, and that engine runs safely for decades. Most people only ever think about their asthma when it is already in crisis. But by that point, the window to act easily has already closed. You now have 6 warning lights: peak flow rate, reliever frequency, nighttime symptoms, exercise tolerance, resting breathing rate, blood eosinophil. If any of them is signaling something, that is not a reason to panic. It is a reason to act. Remember this, 95% of asthma patients who monitor these markers and work with their respiratory team stay out of hospital entirely. That isn't just a number, it's peace of mind. If this has been useful and you'd like to go deeper on any of these markers, whether that's understanding your peak flow zones, what biologic eligibility really means, or how to interpret your blood eosinophil result, please do let me know in the comments below. And if your asthma isn't fully controlled right now, a specialist respiratory assessment can change the picture entirely. The link to book is in the description box below. See you in the next video.